about is what we're going to hear today. And so I'll go ahead and start introducing our panel speakers today from left to right. Our first is Maluska Mejia. So Maluska is from Lima, Peru. They call the City of the Kings, which I think is rightly so, as a third of the population of Peru lives there. It's a beautiful, beautiful place. And Maluska is actually in her 6th year of medical school at San Fernando University in Lima. So in Peru, you go to medical school for 7 years, and you go right off when you get out of high school. And so Maluska is currently doing a cardiology rotation at the clinic, and she will be going back at the end of December to finish her 7th year. And so while Maluska is not studying, she's the editor of CIMAL, which is a science and investigation journal that medical students in Latin America participate in, and she's been the editor for quite some time. And I think this year was you were really successful, Maluska. I think she had like 6 publications this year, so she's been hard at work. And when she's not doing that, she's involved with PAMS, which is the Peruvian American Medical Society, and she focuses on the Chincha branch. I think she's done it about 3 or 4 times, and the last time, if you see Maluska, she's actually right there. And then if you look over there's a really good-looking guy who happens to be your classmate. I got to meet Maluska this past summer when we were working in the Chincha clinic. So while Maluska's not doing that, she's playing guitar, and she actually there's like a dog opera-like performance that the San Fernando University does, and she played in that. And she also has this odd fixation for the snow, which I don't understand, but she's in the right place. That's what I told her. She was in Rochester last year when she took that photo, and she just thought it was the greatest thing ever. So representing Venezuela today is Dr. Gonzalez. She is the director of the Pediatric Infectious Disease Fellowship at the Cleveland Clinic's Children's Hospital. Thank you for doing that, Dr. Ponte. So we're going to go ahead and get started with the first question today, which I'm going to start with Maluska. And Maluska actually had some slides she wanted to show, but essentially, what is the healthcare system of the country you're from?
Good morning, everybody. I'd like to take a moment to thank for the invitation, and a special thanks to Andrew for organizing all of this, and thank you guys for showing up. So, I would like to start with some numbers. Actually, one number, 50%. Over 50% of the physicians who practice in Peru are located in Lima. And there's another number, 90%. 90% of the hospitals of the government are located in urban areas of Peru. So what do these numbers mean? If I could choose a word to describe it, I would say inequality. We have a serious issue in terms of distributing healthcare in my country. As you can see, Peru, it's a beautiful country, very diverse. It's divided in 3 natural regions: the coast, which is by the sea, the highlands, and the rainforest, each with completely different health issues. This country has had a tremendous economic growth in the last 10 years. However, this growth is not equally distributed in all of the areas of Peru, especially in the highlands and in the rainforest. There are people who are excluded of this growth, and they don't only have limited access to education and to work, but also to healthcare. So on top of that, there is the language barrier. There are over 70 linguistic groups in Peru, which also limits our access to healthcare in my country. Next one, please. So this slide is to show how is the structure of the Peruvian health system. There are 2 main sectors, the public sector and the private sector. I'm going to be focusing on the public sector, since there's not much to say about the private, except that it's afforded to anyone who can pay for it out of pocket, in the case of the private profit sector. And the money comes from mainly donations in the case of the private non-profit sector. So for the public sector, it has 2 arms: a subsidized regimen and a contributive regimen. In the case of the subsidized regimen, the money comes from the government, from taxes, to create a public health insurance called SIS. This insurance is intended for people who live in conditions of poverty and extreme poverty. The other arm of the public sector is the contributive regimen. In this case, money comes from 9% of the salary of all employees who are registered, who have Social Security, and for their families, for retired people. This is called salud. in terms of percentages. The public insurance I mentioned, Cis, which is for povers and skin povers, covers 35% of the population. 21% of the population have social security, so they have access to this health insurance called Salud. And a minority, only a 4%, have private insurance. And as you can see, there's a big percentage of people who don't have any kind of health insurance, 40%. This is formed by people who work independently, 20%, and excluded populations, mostly people who live in remote areas, like I mentioned, in highlands or rainforests, indigenous people, and the elderly. So that would be in summary.
Thank you, Melissa. All right, I'm going to go ahead and we're going to switch to Venezuela. So Dr. Gonzalez is going to give us an overview.
There's a question here.
I don't know if we're going to have one answer the question, but we won't. I don't know if due to the time constraints we might have time.
Okay, it's a quick question.
Yeah.
So the public healthcare system, the left side serves the ones in extreme poverty, the right side serves retired and elderly people. What happens to working people? Do they take advantage of the public healthcare system or the private?
People who work?
Yeah, so like people our age, young, not
Yeah, so if
elderly.
you have a registered job, means you have social security, you will be part of the Salud. So 9% of your salary goes to this insurance.
Okay, so it's not just retired and elderly.
No, it's anyone who works, their families, if they don't work.
So in Venezuela, the healthcare system is very similar to Peru. And just a little bit of a history of the public health system in Venezuela. Really in 1912 was really when the public health services were established for our country.